Greetings and welcome to the Hypnorth Natural Birthing Podcast, Episode 1. My name is James T. Griffin.
And my name is Santha Lei.
And we feel so happy and grateful for our first podcast episode. We have Dr. Rose Kung, an obstetrician. And why we have Dr. Rose Kung on this episode today is because she helped Santha give birth to her first baby. And as we mentioned, Santha had no pain and quite the comfortable birthing experience. So what we're going to do is we're going to have Dr. Rose Kung. She's just going to share her experience of what she witnessed with Santha during the birthing process and afterwards as well. So again, welcome, Dr. Rose Kung.
Thank you, James. Thank you, Santha.
You're welcome. Good. So without further ado, Dr. Kung, please share with our audience what you observed during the birthing process when you helped Santha give birth to her son, Sebastian.
Great. Yeah, I was quite amazed and surprised, pleasantly so, by her complete control of the situation. So it appeared to me like she had an epidural, but of course she had not. And she was pain-free, as well as just like any other person who had an epidural. She was very focused. She was obeying like suggestions to when to push and when to stop, because oftentimes individuals who do not have an epidural and are experiencing natural childbirth without hypnotherapy become very uncomfortable, and I guess it's a very unpleasant experience. And the lack of control at the very end can sometimes lead to bad tears that require sometimes difficult repairs. So that was definitely not the case with Santha. And she was the first person I've had undergo hypnobirth, the first, at least my own patient. But after Santha's experience, I did manage to take care of someone in labor who was not my patient, but one of my colleagues who also had a hypnobirth and was completely in the zone, so to speak. Like she was completely controlled. When her contractions came, she was breathing, and she paced her breathing so that she could avoid unnecessarily pushing when she wasn't quite ready to push. So she was able to carry the pregnancy, well, not the pregnancy, but the labor to the very end in a very controlled fashion, and thus minimizing any perineal trauma. And it was quite amazing to watch. I don't think you would believe it unless you see it for yourself firsthand.
Yeah, so out of all the years you've been helping women to deliver their babies, you only witnessed two expected mothers have this epidural-free, pain-free experience?
Yes, although there were other people who had experienced childbirth without an epidural. Yes. And was relatively controlled as well, but it was more with either acupuncture or with nitrous oxide, which isn't always available. But it's not the same. It's not the same as someone who is focused and really not, I wouldn't say out of control, but just not comfortable with their surroundings, compared to someone who has hypnobirth and someone who had an epidural. So sometimes the epidural doesn't work either, right? And then there's kind of experiencing a very unpleasant experience as well. So I haven't seen anyone who's was engaged in hypnosis early on during the labor process, or before, I guess, is when they started the training, be out of control, so to speak. Like they would be able to follow instructions. And sometimes the instructions are the opposite of what you might think. Sometimes it's don't push as opposed to push. And that's where it's really hard for those individuals to control the urge to push when the sensation is so strong and the discomfort is so real.
Yes. So at this time, I know Santha gave birth to her son 21 years ago. At this time, is natural childbirthing without epidural, is that increasing in popularity? Is that increasing in demand? What have you noticed the shift between 20 years ago and now?
I don't think necessarily the epidural is fading, except there are more midwives involved now in childbirth. So, and they have a birthing unit or a birthing center, I should say, and that's not staffed by anesthetists who give the epidural. So their options for pain control is somewhat limited.
Yes.
And there's some people who choose to have home births as well. So that's obviously not a medicated environment or medicated type of environment that you can easily achieve. So I think those individuals may wish to have an option for better pain management in a setting that's not in a hospital.
Yes. Okay. And in the obstetrician world, is there any talk amongst the community about hypnosis and its relation to childbirth, or is it still really not that talked about?
I don't think it's that large a topic that that generates a lot of interest.
Yes.
So normally in a hospital setting, like the obstetricians obviously deliver the babies, but we don't manage the pain. Whereas the anesthetists manage the pain and they don't deliver the babies, but we work together. And oftentimes the nurses are the ones who are counseling or coaching the patients one way or the other, right? So whether they feel that the patient or the client just wants or needs an epidural because they're not coping well with the pain, for example.
Yes.
And sometimes the doctors would order medications to make the labor contractions stronger, which makes the pain worse. So then at that point, the nurse would be like a patient advocate and say, is it time that you would like to consider an epidural? So it's not it's not uncommon, let's put it that way. I mean, for Sunnybrook, I would say about 95% of women would have an epidural.
Yes. Okay. And sometimes you said, yes. And you said sometimes the epidural does not work or it has a limited effect?
So sometimes the epidural is not, I guess, complete. Like the pain relief is not complete. It might be one-sided. Or it's possible that there's some anatomical issues that makes the distribution of the pain medicine unequal. Or sometimes the person is getting used to the pain, and then they can't, I guess they need higher doses or different types of pain relief. And that's usually happens in an obstructed labor type pattern. So they've been in labor for many, many hours and it doesn't look like they're getting anywhere. Yeah.
At what point did you become aware that Santha did not want an epidural and use this concept of hypnosis and hypnobirthing?
Boy, I don't know. It's been so long.
Oh yeah, 21 years, I guess.
I don't really remember what happened in terms of the labor part. Only the fact that it's as if she had an epidural. Like it never even crossed my mind that she didn't have one. I mean, I probably didn't even notice really.
Oh, so did it, like, Santha, do you remember, did it come up in conversation after you gave birth? You said, oh, by the way, I had this training. What do you remember, Santha?
I think I would have already told Dr. Rose in one of my later appointments. I'm sure I had mentioned that that I wasn't going to use epidural. And also I believe when my water broke and I went to the hospital, I'm pretty sure that you also asked me at that moment, do you want epidural? Are you sure you don't want it? So at that point, I remember telling you that, yes, I'm sure I don't want it. I have my hypnosis recordings to listen to, which helped me relax already. So yeah, I'm pretty sure you asked me at that moment too. Are you sure you're not going to change your mind? Are you sure you don't want it? I said, yeah, I'm sure. Thank you.
Yeah, that sounds right.
Yeah.
Well, again, 21 years ago. Yeah, sometimes you don't remember the finer details, but yeah. So I just wanted to ask that question as well. And one more question in regards to childbirthing. Would you, from your professional perception, Dr. Kung, would you recommend a woman taking a more relaxed approach to birthing or a more tense approach to birthing while they're giving birth?
Well, I always think that if you have very tense pelvic floor muscles, it actually impedes the head from descending.
Yes.
So that's why sometimes individuals who have like they call it vaginismus or spasms, levator spasms, makes it more difficult for them to push because sometimes it's involuntary.
Yes.
And so it's like working against the uterine contractions, right? So it's making the opening, the vaginal canal, like tighter, so it's harder for the head to mold and to come out. So it's always better to be relaxed, and I think that's why the epidural works well because it relaxes everything. But as I said, there might be some situations where it's even if the individual wants it, it might not be possible because of previous medical conditions that won't allow the anesthetist to put in that catheter. Or it could be something anatomical, or it could be something medical, like if they have a tendency to bleed easily with low platelets or anticoagulants or something like that, that makes it very risky. So it's useful to have an alternative, right? And I don't think there's a downside for sure. So, and if you're stuck in a situation where, like even at Sunnybrook, where we have in-house anesthetist, but it's a busy place. So even if you wanted an epidural, they could be busy doing a section or doing someone else the epidural. Like there could be many situations where your procedure might be delayed. So, and that could be for an hour or more, or yeah, it could be more because
Yes.
emergencies can happen at any time. So I think if you're able to control your pain experience, then it doesn't hurt, right? It doesn't necessarily, it's not necessarily exclusive or mutually, they're two not necessarily exclusively, mutually exclusive procedures or choices. It's just at least you have a chance or an opportunity to not have as bad an experience or not have as painful an experience as you necessarily need to, right? So I don't think people who want to have a natural childbirth really want to experience the pain part of the natural childbirth. They may not want to experience the medical part, and that's why they think natural is good. But most of them have never had this experience. So, and I've seen some people say that it's almost like a post-traumatic stress sometimes when the pain is so bad, or at least in their experience is so bad. And so anything to reduce that experience, or I should say improve that experience, is, I think, beneficial. I mean, honestly, I don't know how many people are going to choose this route versus the more traditional, I guess, epidural. But I also don't know how many people are exposed to this opportunity, like are aware of this alternative. And speaking to some of them, I mean, even today, they seem to have an open mind. So we'll just see what happens. If it's made more readily available, then more people might choose to use that option, right?
Yes. And one last question, Dr. Rose, is after Santha gave birth, what did you notice about Santha and her consciousness and how she was in that recovery mode? Because after a woman gives birth, she could be maybe a little disorientated, maybe low on energy. What was Santha like the day, like after she gave birth? What do you recall?
Well, I should say most people after a long labor, they start, having a lot of shakes and stuff. And it's not necessarily them, but it's because usually we give a lot of fluids, and the fluids are room temperature, so it's cold. And they've also expunged a tremendous amount of energy with the pushing and everything. Some people say it's like running a marathon, right? So I didn't recall Santha having any of that, and she was, very alert, and she wasn't in any distress, and I mean, she seemed to bounce back fairly quickly. Usually I see that, in someone who's had, maybe their second or third baby, because usually those labors are faster. And so then you don't spend a lot of, I guess, energy, because you should know that you're not really eating anything, right, during this whole process. So you're starving, and then you're pushing, and then there's all this other stuff going on, and so you're pretty exhausted. But I certainly didn't notice that with Santha, which was great, right?
Yes. I actually ate. I snuck some food in when everybody left the room.
When everybody was not watching or something.
Exactly. I said, Roland, give me that bagel. And then right after I gave birth, I again said, Roland, give me that bagel.
Yeah.
I think I brought 2 or 3 bagels, and I immediately started eating right after the baby was out.
Yeah, because the reason the nurses don't encourage a lot of eating, like solid foods, is because oftentimes, with or without the epidural, but oftentimes a lot of women get nauseated.
Yes, and throw up.
And they throw up, and they feel awful, when you throw up. When you're pregnant, if you're pregnant or not pregnant, it doesn't really matter, but you feel awful. And so it makes the whole experience even worse. So they don't really encourage, like the nurses don't really encourage people to eat. Mm-hmm. They encourage people to drink, and because they need to keep hydrated, but they don't like to encourage people to eat, because oftentimes the stomach doesn't empty that well in the pregnancy, and the food just gets stuck there, and then that's why people feel nauseated and they throw up. It's not uncommon.
Yes.
Yeah.
Okay. Excellent. Now, again, thank you for coming on to this podcast episode, Dr. Rose. And I just wanted our audience to hear your perception. So it's not like you're recommending anything, but you're just sharing what you witnessed, and just, again, letting everybody know there are other possibilities out there. So we very much appreciate your time and energy, and thank you for being such a great support to Santha as she was giving birth, because she's only said beautiful things about you.
Yeah.
You're more than welcome. Yeah, I hope more people try this experience, and hopefully they'll have just as great a result as Santha has.
Yes, I hope so too, because it really was the most amazing experience, and I'm so proud of the labor. I mean, not labor, but this easy childbirth experience that I just brag about it all the time to my friends, and they're just so jealous to hear that, because all of them have gone through quite significant pain, and one of them actually almost lost her life. So, and for me, it was easy breezy. So what can I say? I recommend it to anyone who wants to not have pain.
Yes. Okay. Well, again, thanks again for coming on the podcast, Dr. Rose. And thank everybody for watching this podcast, and tune in for more upcoming episodes of Hypnorth Natural Birthing Podcast. So thanks for tuning in, everybody, and we wish you a very beautiful day.